Today is Tuesday. It's Nclex Test Tip Tuesday. And here is your Nclex question of the day. All right, we're going to talk about a few test tips as you're reading through this question. I recently had a student that passed their exam, an LPN student, and one thing she mentioned that she recommended is that you go to the NCSBN website and you do the questions that are available for you to download. Now, within the test plan, there are some sample questions where they do give you the answers. I would go through those as well. Those are going to be pretty simple, probably pretty basic questions with basic answers, but you want to be able to tackle some more complex questions. So they do also have a set of questions that you can download and receive and do, but they don't have the answers to them. But they're going to give you good information, content that you want to pay attention to so that you can learn and study that content and go back and try to answer the question. So even if you don't have the answer, you may be able to get with your tutor to talk about the answer to the question or discuss the different options, see if there's any testing strategies that you could use to get to the correct answer. So they don't give you the answers and rationales, but what I like about it is it gives you a chance to see how the questions will be, how they're worded, how to approach those questions, and you get used to seeing their style and what type of information it's important for you to know. So if you're not familiar with at least that information, then I would say you're not quite ready. So you want to go with what you know, but you have to know before you go. All right, before you go take that test, you want to know as much as possible. Number one, you want to know as much content as possible. That's your case event. You want to have adequate amount of practice in questions that present different case events to you, not just case studies, but just a scenario. Just what is the types of topics and subjects and content that you need that these questions are asking you about. Number two, you need the query. So one thing is case event content. Two, query. Understanding the question. What are these questions asking? Is it a negative? Is it a positive? Now, understanding the question may involve also being able to break down what a question means, and that sometimes that takes test taking strategy. So you have to know those test taking strategies before you go, but go with what you know. Lastly, so you want case event, you want content, you want to understand the different types of questions, and you're going to use the test taking strategies, those three things. All right, so if you miss a question as you're studying or studying, doing your self-independent study or studying with a tutor, as you miss questions, you want to make notes. And this is kind of how I want to show you how to make your notes. All right, so in this question, we notice that they are asking us about the charge nurse should assign the only available private room to which client. So we have only one private room that we need to assign to a client. Who needs that private room more than anybody? Go back to your case event. The case event is that the charge nurse is in a long-term care facility. Now, this comes from the LPN questions. So not only do I expect my RNs to be able to answer this, but I expect my LPN students to answer this. So it's a long-term care facility. The charge nurse has been advised that the following assigned clients will be admitted during the shift. So who are our patients? Who are our clients? We have four. We have a Hep C patient, a patient with a positive varicella zoster titer. We have a patient with PCP. We have a patient with CMV. So they all have some type of infectious disease. So what you want to keep in mind is the patients who need isolation, who need a private room, are going to be those who need airborne isolation. Their disease is carried through the air. C, so no B's, but A, B, C. Let's go to C. C is contact. Contact means if you go in that room and just touch some stuff, or touch on that patient, you could get that disease, something like C. diff. Airborne, something like TB. So airborne, you want to think TB, anything related. Contact, always think of C. diff. What else? D, droplet. Anybody that we need to go in the room with just a regular mask, maybe not just airborne is even more. I feel like it's more potent, more stronger because those particles are a lot smaller, and so you need an N95 mask and probably a HEPA filter in the room, a respirator. But with droplet, those particles are larger, so you can prevent breathing those in with just a surgical mask, just a regular mask like we would wear when we were outside and we're trying to protect ourselves from like pneumonia or COVID or things like that. We could wear a droplet mask. Now, in the hospital, we do COVID as airborne as well. So we do wear our N95s. But droplet are for those larger particles. Someone has a cold, I would want to put on a droplet, put on a surgical mask and put them in droplet precautions. All right, can you think of anything else? Airborne, contact, droplet. Those are the main ones. So it's through the air, contact, droplet, isolation. You do have neutropenic. Neutropenic are patients who need to be protected from other patients, and maybe they need to go separate or maybe you can group them with somebody who is also immunocompromised as long as that person doesn't have an infection. But we're going to deal with ABC because those are people who really need private rooms, and because we're trying to prevent their infection from being spread to others. Hep C. So when you think of Hep C, you want to think about a little bit of the C can kind of, spark your memory of contact, but it's only if you're in contact primarily through blood. Notice there's a triangle here. This is from Saunders. So they put triangles by things that are highly tested information. You want to know how the disease is transmitted. So Hep C transmitted primarily through blood. So if we get a needle stick, notice that people who are at higher risk are drug users. If they are parenteral drug users, that means they are not ingesting drugs or inhaling it, they are injecting. So needle sticks. Blood transfusions, there again, you're getting in contact with the blood. Healthcare personnel, when we work around patients, we are at a high risk of getting HBV, hepatitis B, which is a similar transmission as Hep C. So those patients don't have to be necessarily isolated. We just have to make sure we use standard precaution. And if I'm handling any of their blood or body fluids, yes, I'm going to wear a glove. I don't want to be stuck by needles. You got to be careful how you're handling needles after you have to give that patient something, or if you have to draw their blood. All right, there can be chronic complications that can develop. Prevention, strict hand washing. All right, so that's what you should have in your notes so far. Hep C, contact with blood. You need strict hand washing. You need needle precautions. We need to screen blood donors. Start out with that few first simple information, and that goes right along with what we just looked at, strict hand washing. Well, I don't want to come in contact with their blood or body fluids. Parenteral drug users, yeah, I don't want to be stuck by their needles if I have to give them a shot. Blood transfusions, yeah, we need to screen blood donors and make sure they're not carrying Hep B or Hep C. Very similar. Healthcare personnel, we know we need to be doing all of these three things. Or if we are aware that a person has Hep B and Hep C, just be careful, but you want to treat everyone with that standard precaution. But otherwise, nothing very special. Now, varicella zoster, you want to know that anything that has zoster at the end is herpes. It's the herpes virus. But particularly if it's varicella, you're going to think about chickenpox. Varicella zoster, chickenpox. Okay, it has a C in it. So varicella is chickenpox. And yes, with chickenpox, we need to do what? We need to isolate that patient. We got to isolate them. All right. What's the other zoster? There's one other zoster that we need to isolate. Very good. If you thought about shingles, shingles is known as a herpes zoster. All right. So herpes zoster is shingles. Varicella zoster is chickenpox. If they say herpes simplex, then that's like a cold sore, or it could be herpes simplex 1 or 2. 2 has to do with, specifically has to do with your genital type herpes. So, varicella zoster, you're going to think C with the chicken pox. Herpes zoster, you're going to think shingles. And both of these patients need to be isolated. We're going to isolate chicken pox. What are you going to put them in? You're going to initiate airborne isolation and contact precautions. Airborne and contact until the vesicles have crusted over. Standard precautions as care necessitates. Because for everybody, we're going to use standard. What about PCP? PCP is a lung infection caused by fungus pneumocystis, and I'm probably going to mess this up, Girovesi, but we call it PCP for short. Some places may also know it as PJP because of the Girovesi at the end. But it usually affects people who have weakened immune system. If you're healthy and you have a strong immune system, typically this is something that we're all probably exposed to, but we never develop an infection because our immune system has built up some immunity or resistance to it, so we don't get sick. But people who have a weakened immune system, they can get this. So this is a clue. If you ever get a patient that's coming in with PCP pneumonia, you're going to think, oh, something else must be wrong with them. They're not just a healthy individual. They probably have HIV. HIV is probably the top condition where we see this PCP pneumonia happen. And those taking medicines that lower the body's ability to fight germs. So anyone with a weakened immune system are at a higher risk. But typically we see this in HIV or AIDS. Can be serious, can be life-threatening. A lot of times this is what takes a lot of people out because with HIV or AIDS, because of the infection to the lungs and that type of pneumonia, airway and breathing, right? That's one of the top priority conditions, top priority ways to, lose life, A, B, and C. All right. Lastly, we're going to talk about CMV. Put this in your notes, CMV. What is CMV infection? So as you're studying a question, you look at each thing that they're mentioning and you write it down and you figure out, what do I need to know about this in case I get a similar question? If I get a question about CMV, then I want to know that the organism is transmitted through close personal contact or across the placenta. So a person who is pregnant doesn't need to be exposed to CMV. The fetus may be infected through the birth canal. CMV causes low birth weight, causes a lot of impairment in things and abnormalities with the baby. Antiviral medications may be prescribed for severe infections in the mother, but these meds are toxic and may only temporarily suppress the shedding of the virus. So this is another virus. So that's our CMV. All right, so which one was the worst that we really need to put them in isolation? You may think about chickenpox because this is something anybody can get if you're not immune, if you haven't been vaccinated, or anyone else who is ill and immunocompromised can get this airborne contact spread infection. So any of those childhood diseases, you definitely want to isolate those patients. All right, so we're going to go back to our question. All right, so we need to figure out, who do we need to put in a private room? We said Hep C is just basically contact with the blood or body fluid. So we can prevent needle sticks. We have a way to prevent that. We don't have to worry about just going in the room and we're not going to breathe it. We're not going to put them in airborne. We don't necessarily have to put them in contact, only when we're in contact with their blood or body fluids, but that's any patient. Just like with HIV or AIDS. Okay, so just contact with their blood or body fluids or needle sticks. So that's basically standard precautions for anybody. I don't want to come in contact with anyone's blood or body fluid. So we can probably get rid of Hep C. Varicella, we said yes, they need airborne and they need contact isolation. PCP pneumonia, not so much, right? Mostly those patients who are at risk for PCP are going to be those who are have a very low immune system, or low or a higher risk for developing this pneumonia. They have they're more immunocompromised, like HIV. So if we go in the room, am I going to be worried about getting PCP from them? No, not necessarily. No. All right. So as a nurse, again, standard precautions. CMV, unless you're pregnant, we're not going to have any pregnant patients or nurses take care of that patient with CMV. But other than that, good hand washing. You're not going to breathe it in. You're still going to use your standard precautions as you would with Hep C or the PCP patient. So the one who really needs the isolation room is going to be the patient with the chickenpox, varicella zoster, because we have two things that we got to do: airborne isolation, contact precautions for that patient. So go with what you know, but you got to know before you go. You got to get that information. You got to get that content. You got to focus on remembering the information. How am I going to remember this? Use pictures. Use written terminology. Highlight things in your notes. Think about the little chicken is in the jail. We're isolating him. We're going to put him in jail, right? Varicella has a C. The C zoster, you're going to think about C for chickenpox. And you're going to think about C for contact and airborne. All right. And there's an A in here. Airborne, contact, chickenpox. So have some fun way of being able to remember that information. And look at that. Look at it. Study it every day. Study that one for a few days. And every time you get a patient not a patient, but a question with CMV and PCP pneumonia and varicella zoster, chickenpox, or Hep B or Hep C, you're going to remember how is it transmitted and what do I need to do.